Let's bring in ABC News Deputy Political Director Averi Harper, as well as Dr. Todd Ellerin, Interim Chief of Medicine and Director of Infectious Diseases at South Shore Health. Averi, let's start with you. Biden's physician, Dr. Kevin O'Connor, you've heard that name a lot lately, says the president does continue to feel well despite his test remaining positive. So what can we expect with regard to Biden's routine, and when will he come out of isolation?
Well, your guess is probably as good as mine at this point. We know that the White House is waiting for the president to test negative for COVID-19. We know that he has been eager to show that he is working in isolation, that he is feeling fine, but we know that he is really at the mercy of a negative test.
All right, and Dr. Ellerin, you know, while we continue to follow this story, clearly this is the second time that Biden has tested positive for COVID. Not really a big surprise, because we have talked about rebound COVID after taking Paxlovid, but in the case of the president, we didn't know until, because he spoke right here in the Rose Garden last week saying he was feeling great, everything was fine. This isn't a unique thing, but it is a small number of people that have experienced rebound COVID after Paxlovid, right? What's kind of the long-term situation now, you think, for the president?
That's right, Kara. I mean, I think the drug is still doing what it's supposed to do, which is keep people out of the hospital. So President Biden, because of his age mostly, is at high risk. And the Paxlovid has kept him out of the hospital. That's good news. In a small percentage of patients, like you said, about 5 or 10%, you know, I know it seems like a little bit higher when you're in the real world, but those are the numbers that so far have been studied. People do get this rebound. Now, the rebound typically requires two things. One is a rebound in symptoms, and another is you go from negative testing to positive testing. We're hearing that President Biden doesn't have symptoms and just went from negative to positive. So he may not fulfill that criteria perfectly, but he is the president. So the fact is that he has a positive test. They want him to still isolate probably for at least another 5 days, and we'll see, you know, what they decide after that. They may require him to come back with a negative test as well. But the key is he's doing well, and most people with Paxlovid rebound do have mild symptoms and generally doesn't lead to hospitalization. So what I don't want is people to be scared about the rebound and then not take the Paxlovid. With that said, it's only recommended for high-risk people with COVID, not standard risk. So most people in the country, it's still not recommended.
So is it okay for the president to take it again?
Right. So, you know, you actually heard that, you know, even when Dr. Fauci had COVID, he did have the Paxlovid rebound. He took 2 courses of it. President Biden has taken 2 courses. The CDC currently is not recommending it for most people, simply because most cases are mild. But from my perspective, when I see a high-risk person with the rebound, I usually think, well, are they at high risk for severe illness? And if they are, I will offer them another course as well. But I do want to be clear that the CDC is not recommending a second course for the majority of people with Paxlovid rebound.
All right, so Averi, let's move it into the political implications here. The president's announcement, you know, coming at a time that he was hoping to get out there on the road again before midterms and tout his agenda. So do you think this is going to hurt him publicly, not being able to make these political trips? Because when he tested positive a couple weeks ago, that was the chatter out there. What does it say about his health, his ability to campaign, get out and start politicking during midterms and, you know, prior to possibly announcing a 2024 run?
Right. Well, we know that the president, his bread and butter in terms of campaigning is really being out there and talking to people. He was slated to go to Michigan tomorrow. Tomorrow is primary day in Michigan, and he was going to talk about the passage of the CHIPS bill, the impact that that legislation is expected to have on semiconductor manufacturing jobs in a state like Michigan. That's something that's really, really important. We know later on this week, Democrats hope to pass massive legislation with items that are really central to Biden's agenda, things like environmental, addressing climate change, lowering the cost of prescription drugs, reforming the tax code. These are things that President Biden wants to be able to take a victory lap on. And because he is in isolation, he's not going to be able to do that. So, you know, will it hurt him? I don't necessarily think so, but he will not be able to get out there in the ways that he wants to and to celebrate those policy wins like he would normally do.
All right, Averi Harper, Dr. Todd Ellerin, thank you both so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.